We appreciate the opportunity to meet with you. My name is C.Bogosta. I'm the president of UPMC Cancer Center. And I was asked actually to come and do two things today. One is present our qualifications and also to present some initial reactions to some of the work that you've already done in the planning for the development of the National Research Oncology Center. So next slide. I won't go into depth here. I just wanted to basically give you some sense, and as it relates to the transfer of technology, what you would be accessing from us would be the billions of dollars that we've invested over the years in healthcare. We're not a consulting company. We're a healthcare provider, and we are a company that has actually taken on the responsibility for developing cancer centers all around the world. Probably the most important thing on this list of things that we talk about is the fact that we actually have three areas that we excel in. One is in research, one is in education, and the other is in the clinical areas. We're the largest integrated healthcare system in the United States. What that basically means is that we have a health insurance company, and we have a very large provider network, and we have overlaying that an academic medical center. Next slide. For UPMC Cancer Centers, we're the largest integrated cancer center in the world. What that means is that we see more patients than cancer patients than any other cancer center in the world. That actually has a lot to say about what happens in our region that we're in Pennsylvania. There's a very high incident rate of cancer there. Our partner is the University of Pittsburgh. We're a National Cancer Center Institute, designated cancer center. There's only 35 of those in the country. We have 40 locations in western Pennsylvania, and we currently have 4 locations for cancer centers overseas, one in Italy, two in Ireland, and one in Singapore that's under development right now. Next slide. As it relates to how we compare to the other organizations in the world that do the kind of work we do, what we decided to do was to try to give you a sense of it based on this graph. And on the bottom section of it, it has our clinical operations expertise. On the left-hand side, you have research operations. And as it relates to having international experience in both research and in the clinical areas, we're really the only organization that has been able to develop what we describe as an exchange program, where we bring technology to another country, but there's an exchange from the other end. And now, on the next slide, I'll explain what that means. This is really important, probably the most important slide here in terms of understanding our qualifications. We don't simply just export what we do. What we've found is that when we partner with another country, we go in and we take the best of what's in that country and the best of what we have to offer, and then we customize it. So although we have not been on the ground here yet, the plan would be to come in and really customize a program that makes the most sense for the citizens of Kazakhstan. We also don't have a one-size-fits-all approach. We approach things in a very customized way. We have a very strong background in cultural sensitivities and understanding the nuances of working in various countries. We count on heavily on you to help us with that. We're the only U.S.-based not-for-profit in the world that, as we like to describe it, that is responsible for the direct care of patients. So, for example, at 3 o'clock in the morning in the United States, we're actually worried about patient care in places like Italy and Ireland and Singapore and China. And lastly, our track record is unmatched. There is no one that has as much experience as we do overseas. Next slide. I had been asked to actually provide comments on 2 documents. One is the Minister of Health's Kazakhstan Cancer Program from 2012 to 2016. Our initial reaction is that it's an outstanding document. It provides a bold vision. It addresses, obviously, the second most common cause of death. What our expectation is that while incident rates are lower than the United States, we would actually possibly expect those to increase based on better surveillance and better opportunities to learn more about what the cancer rates are. The morbidity rates or the death rates are higher. However, we would expect those to go down based upon the fact that we would have earlier detection. So that's the most important part of the plan, or one of the most important parts of the plan. The Integrated Oncology Center is the correct approach. It's going to improve your access to screening and treatment. You will have a much greater investment in an efficient state-of-the-art technology and treatment in areas such as linear accelerators, stereotactic radiosurgery, PET-CT, the latest drug therapies, and specialized oncology in patients. The other part is it's a very sound approach in terms of developing rehabilitation and palliative care programs. Cancer programs are going to be far more focused on palliative care in the future, and this is a very interesting point because you're going to be able to put yourself in a leapfrog kind of an opportunity to leapfrog over what other countries are doing when you start to develop this. Your approach to research is right on target. It's extremely important to have a strong research program. It adds an enormous amount of credibility to the program. And the one area that we believe will be one of the most interesting challenges actually will be in the area of training and education of nurses and physicians. But our plan would be to work with you, as you've outlined in your proposal, to develop an efficient, effective, and most importantly, a sustainable program, one that maybe someday you won't need us to be even involved in. And that goes back to one gentleman's mentioning before about technology transfer. Next slide. This is a preliminary evaluation of the actual Research Oncology Center here in Astana. We believe it's an ideal location. We are unaware of anything like it in the Central Asian region, which means that we'll be able to attract patients from throughout the region. It should have a very strong positive economic development opportunity. And as I mentioned earlier, one of the key challenges will be education and training. Thank you very much.